Good morning, everyone, and welcome to our first presenter in our series of our AEDY work for the 2021 school year. I am so pleased today to have with us Dr. Perry Rosen. Let me give you a little bit of a background on Dr. Rosen. We actually met several years ago, and I can honestly say I was impressed from day one in terms of her knowledge base and her willing to share with me her knowledge to the field. And so it is my great pleasure today to present to you Dr. Perry Rosen. Dr. Rosen is a consulting psychologist at the Pennsylvania Office of Mental Health and Substance Abuse Services, known as OMSAS, at the Department of Human Services in Harrisburg. She's also a nationally certified school psychologist and a certified special educator. At OMSAS, Dr. Rosen has helped lead several school and community-based mental health and suicide prevention initiatives, including the Garrett Lee Smith Youth Suicide Prevention Grant and the Pennsylvania Network of Student Assistance Services. So without further ado, I'm going to turn it over to Dr. Rosen. She's got a lot of great information she's going to share with us today. And then additionally, I want to invite our attendees to please enter information into the chat box. If you have questions or just simply comments, we're going to tally that information through the course of the hour-long presentation. And then we'll do a short stop at the end and address a few of those questions that have come in. So welcome, Dr. Rosen. It's a great pleasure to have you here with us today.
Thank you so much, Gina. I'm really grateful to be here and have the opportunity to speak with everybody about this really important topic. I'm going to go ahead and share my screen. So give me just a moment. Okay, and I think, is that visible? Great. Okay, so I'm going to be talking today about comprehensive school mental health approaches. And these approaches are really applicable across settings, including public school districts, as well as more targeted programs like AEDY. I think we all can acknowledge how much we've been hearing over the past few months, especially about the need to address mental health more broadly within our school communities. Certainly, it's been a very big topic related to the immediate reentry process coming back to school. But we know there's still, we still are in a crisis, and we know there's a lot of uncertainty still ahead in terms of what the rest of this school year will look like. So, this is really something that I see as an opportunity to focus on mental health and think about the systems and supports that are in place and how to build these more strategically. We know that systems change processes can take a lot of time, but hopefully this broadened focus now on the needs of the whole child is here to stay, and not just something that we're having a conversation about, just because, it happens to be the hot topic for the moment. So before I enter into the presentation, I do want to underscore, comprehensive school mental health is really to meet the needs of the entire school population. And I'm going to focus mostly on some school-wide approaches at Tier 1. I do have a little bit about some of the more targeted approaches, but given that we only have an hour today, this is really a high-level kind of presentation to give a little bit more of a framework as to what this can look like. I also want to acknowledge there's a lot of great expertise in this group, and some of the topics that I'll be presenting on are certainly going to be very familiar to people. You may be implementing different components of this, but again, I'm hoping to frame this within more of that comprehensive approach and how we can build the systems and structures to support this in the long term. I also just want to acknowledge that some of the content from today's presentation is drawn from a national school mental health curriculum that is free and widely available, developed in part by the Mental Health Technology Transfer Center, as well as the National Center for School Mental Health. So I have a lot of resources embedded throughout the presentation and different things that hopefully, again, knowing as we're just going to scratch the surface this morning, that you can certainly follow up on and refer back to as needed. And this slide just provides the mission of the Pennsylvania Office of Mental Health and Substance Abuse Services, which is where I am based under the Department of Human Services. And so I just want to start by reviewing some of the data that really helps inform why we are talking about comprehensive school mental health to address the needs of all students. And I'm sure as school has come back into session, you've all been seeing different things happening, you've had different concerns arising among your students. Feel free to enter into the chat, some of the mental health concerns that you have for your students right now. But we know that mental health problems among youth in general are common. About 1 in 5 students has a diagnosable mental health condition, and about 1 in 10 experience some sort of mental health challenge that impacts their daily life in some way. So, we know that students with mental health needs are in every classroom, in every school. And when we have some of our more specialized school settings where we have students with additional risk factors, we see an even greater prevalence in some of the mental health conditions that students are facing. We also know that in general, the prevalence and severity of mental health disorders and in children and adolescents has continued to increase in recent years. And knowing that adolescence is a key developmental period for the onset of symptoms, but also that we have a significant delay, usually from the onset of symptoms to when someone gets any kind of support or treatment, we know we need to think about how to identify students as early as possible. We know that when mental health needs are unmet and without intervention and supports, symptoms worsen over time. And that puts our students at risk for a range of different negative outcomes like chronic absenteeism, school dropout, substance abuse, and even suicide. We also know that for children and adolescents who do receive mental health services, which is not the majority of students that need those services, most are receiving them in school rather than in another community setting. So we need to think about schools as a key context, especially in terms of addressing some of the disparities that we see for accessing mental health care and for accessing quality mental health care. So just to talk a little bit about suicidal thoughts and behaviors, we know that mental health concerns are common, so are suicidal thoughts among youth. And these data come from a national survey, the Youth Risk Behavior Survey, which gets administered to high school students. And what we know is that about 1 in 5 of youth in high school report seriously considering suicide within the past year. So again, a prevalence that is almost just as common as mental health conditions among youth. And about 1 in 12 or 13 youth report attempting suicide. So there has been a significant gap in the literature, and what you're seeing here is some of the trends in breaking down these data for gender as well as for race and ethnicity. We know there has been a gap in looking at some of the specific subgroups within the broader population of youth to understand some of these trends that we're seeing. But one in particular that I do want to highlight, you can see on the graph on the left that white youth report higher prevalence of suicidal thoughts, whereas Black and Hispanic youth report higher prevalence in terms of having attempted suicide. And for Black adolescents in particular, some recent research is telling us that the rates of suicide attempts as reported by Black youth have increased steadily over the past 2 decades. Our youth risk behavior survey data and even our PAYS survey that we do at the state level, I'll share some of that a little bit later, they do not gather demographics or break down gender into additional categories other than male and female. It's reported in a very binary way, but we do have data from the Trevor Project that does give us a bit more information about youth that do identify as LGBTQ+. And through their annual survey, there's one that just came out with more than 40,000 youth nationwide. And what we've learned from that is that about 40% of all LGBTQ respondents reported seriously considering suicide in the past 12 months. So that compares to about 16-17% of the general population of youth. And when we do look specifically at transgender or non-binary youth, we see that it's more than half of those youth that report having seriously thought about suicide. So I'm not going to go over all of the data on this slide, but as you can see, the mental health concerns among this population are notably higher than the general population and do really have significant implications for our mental health efforts. So working with students in AEDY programs, I'm certain that you have all seen the many ways in which contexts and conditions in which your students are born and grow and live and work shape their development in a number of ways. And we call these contexts and conditions the social determinants of health. There's a real growing focus on looking into the social determinants of health for trauma, for mental health, for suicide risk, for a lot of different outcomes. And these social determinants do contribute to a lot of the inequities that we see in both health and mental health. So at each systems level, all of which impact our children and youth, there are a multitude of factors that can lead to mental health challenges. And we know that risk factors for many common mental health disorders are heavily associated with social inequalities. But at the same time, there are a multitude of protective factors, and those can really serve as a buffer. Those are the skills and strategies that we as educators can help to cultivate in our students. And, you know, the thing I want to emphasize here is that the more support within the child's ecological system, the better the outcomes. And there is a growing research on resilience that shows that it really is communities that can make the difference. And so we'll talk more as we go through about some of the ways that, you know, as schools, we can help to build some of those known protective factors for youth. So I did mention the PACE survey just a moment ago, and I'm sure many of you are familiar with this. If you're not, this is a survey administered throughout the state of Pennsylvania. Schools can opt to participate, and we have a kind of a growing participation with each passing administration of the PACE. The last one was in 2019 in the fall, and it can be administered to students in grades 6, 8, 10, and 12. And so if you're looking at this, this is state level data. If your district participates in this, you know, you might have some of those numbers in your head for comparison purposes. But, you know, I'm bringing this up because of course, not all of these represent a mental health need. But again, thinking about the risk and protective factor concept, a lot of these could potentially impact mental health and potentially lead to mental health challenges or disorders. So a few things I just want to point out, because these will be important as we kind of talk through the different components of comprehensive school mental health. But, you know, as a positive, I mean, there's been a lot of discussion and conversation around school safety in Pennsylvania and nationwide over the past few years. But what's really positive to see, I think, from this data is that the majority of students, more than 80%, do report feeling safe at school. So that is a positive, and school safety is a protective factor, and feeling that sense of safety is really important, as you'll see a few slides from now. But at the same time, less than half of students actually enjoy being at school. So that's something for us to think about in terms of what are we doing to help students feel more connected, knowing that connectedness is a huge protective factor for mental health and suicide risk. And you'll hear me say that a few times throughout this presentation. I also want to acknowledge, you know, of course, these data come from less than a year ago. And as we've seen, a lot can change in a year, given the impact of COVID, given the impact of the racial unrest that we've seen. You know, some of these may not, you know, accurately reflect what students in Pennsylvania are experiencing right now. And some of these may have even been directly impacted by COVID. For example, death of a friend or family member, being worried about running out of food. So the next administration will be in 2021. And it's, you know, again, if you're not participating in the PACE survey, something to really think about as a huge source of data to help inform some of your school efforts. So I briefly just want to talk about some of the legislation, you know, because school safety has been a focus nationwide, and in Pennsylvania, we have had several pieces of legislation that have helped guide at least some of our efforts related to school mental health, starting really with Act 71 in 2014. Many of you are probably familiar with this, but related to that, schools have to have suicide prevention policies and procedures. They have to offer staff training. And student education also is a component of Act 71. With Act 44, this is where a lot of big changes came down. There was the need to identify a school safety and security coordinator. PCCD, the Pennsylvania Commission on Crime and Delinquency, made grants available for schools. It established the Safe to Say Something program, which that's another source of data telling us, the expectation was safe to say. It was established, following. This all kind of came following Parkland, a lot of these conversations. And so there was a lot of discussion around school shootings and school violence in that area. And the expectation, I think, was Safe to Say Something was that the majority of tips coming in were going to be focused on school violence or possible school shootings. And I'm not sure if people have seen the data that came out, but from the first 6 months of implementation, what it's actually showing us is that the highest needs that students are reporting are bullying, suicide, and self-harm, as opposed to some of those larger threats of violence. So very consistent with what I've shown you in the data on the prevalence of some of these issues. And then Act 18 really highlighted trauma and the need to infuse trauma-informed practices into professional development plans, and also added some requirements for trauma-informed education. But all of these things really fit together. And I do want to underscore that as well. When we're thinking about comprehensive school mental health, we can look, and you'll see this in a few slides, but we can look at across all of our initiatives and see them as really complementing each other and being aligned with one another, as opposed to being separate things that we need to kind of look at in piecemeal. So I really want to encourage kind of thinking about how these pieces fit together and how we can streamline our efforts, because the last thing that schools really need now is to find time for more initiatives and separate initiatives and additional teams meeting and things like that. So that's really an important consideration with this work. So this is the framework for safe and supportive schools, and it's been developed by 6 national organizations and has been out for quite a while. You'll see the citation is 2013. So again, kind of the need to focus on mental health in schools has been out there for a very long time. It's just that we haven't had as much of an opportunity to do that as explicitly as we do now. And so we know that addressing mental health is a key component of school safety. And, even kind of reflecting on the school safety grants that came through Act 44 that I was just talking about, kind of in that first round, we saw a lot of schools looking to install more physical safety measures within their school settings. Glass, a certain kind of glass on the windows, or locks, or, things like school resource officers, where since that first year, following that first year, there has been a shift to thinking about things like staffing of more mental health professionals, or the purchasing of certain evidence-based interventions that are more in line with social emotional learning or trauma. And so kind of acknowledging the need to attend to the emotional or psychological safety as part of school safety efforts has certainly come more into the forefront. The other reason I'm also sharing this is to underscore that you're probably already working on several of the initiatives that are kind of outlined in this framework. But again, with the shift to COVID, we're thinking about some of these things a little differently, right? Physical safety isn't so much about, those metal detectors or locks as it is now about distancing and masks and hand washing and things like that. So there's a lot to kind of be thinking about now in making sure our environments are physically safe to help promote that sense of emotional safety, and for students and staff to feel like they're being supported within that environment. So I want to now define comprehensive school mental health systems. I've been talking about this, this idea of comprehensive school mental health. And really what this is a comprehensive school mental health system provides a full array of supports and services that promotes positive school climate, social emotional learning, mental health and well-being, and also trying to reduce the prevalence and severity of mental illness. It's built on a strong foundation of professionals as well as partnerships, and we're going to talk about that a bit more. And again, as I was talking about earlier, really looks at those social and environmental factors that impact health and mental health. So when these systems are effective, They contribute to improved student outcomes, which is of course something we want to see, but they also contribute to improved whole school outcomes. And that includes increased student engagement, better academic outcomes, fewer disciplinary actions in schools, as well as fewer special education referrals, or the need for more restrictive placements, among other outcomes. And so these are some of the core features of comprehensive school mental health systems. And so as you're looking at these, just think about which areas that your districts or your programs are doing well in. And, consider how some of the stakeholders within your school community might respond to that same question. And, what are the areas where you feel more development would be needed? So to talk through some of these a little bit, we know that staff are the foundation of comprehensive school mental health systems. And we know that looking at ratios, for example, with our school mental health professionals is really essential. There are shortages in Pennsylvania and nationwide. And so that's something to be aware of, and can also help inform our decisions if needed to look to our community partners in terms of how they can also help support these efforts. But we also want to consider how these staff are trained. And we know that there's wide variability in terms of the training of some of these professionals. When we think about collaboration and teaming, we want to think about how we're engaging youth and families, and that comes into play across many aspects of programming and supports in schools across many different areas. But as far as mental health, we know that students have better outcomes in school as well as in mental health treatment when families are engaged. So it's something to be thinking about in terms of how we are doing that and what input and participation we have in these efforts. And as I mentioned with the community partnerships just a minute ago, they can help augment those services when we're talking about improving access to mental health treatment or thinking about a broader array of supports that we might be able to provide within our schools. We're going to talk a little bit more about MTSS, multi-tiered systems of support, in a minute, but this is really kind of the overarching framework that we're using to guide our school mental health efforts, just as we're using it to guide our behavior initiatives and our academic initiatives as well. Comprehensive school mental health also fits into that structure. And this is where we're embedding those evidence-based or evidence-informed interventions and services. Looking at cultural responsiveness and equity, we know that we need to be responsive to the cultural values, the beliefs, and the behaviors of our families, and think about how we're helping to ensure equitable access to mental health supports and services for all students within our school community, and also looking at what disparities do exist and how are we actively working to reduce some of those disparities. And finally, with data-driven decision-making, we know that data is at the core of our decision-making processes, and this is a foundational element. We're going to talk about this a little bit more as well. So as we circle back to discussing, this multi-tiered framework, we want to really think about how we are systematically identifying student needs and monitoring progress. So utilizing a multi-tiered system or a multi-tiered decision-making framework helps to reinforce this idea of mental health for all, and it reduces some of the bias and subjectivity that we sometimes see in our schools in terms of which students are receiving support and which students are getting identified. We know that we've, with other structures we put in place with PBIS and things like that, we've tended to be better able to identify students that are showing externalizing behaviors. We have not always been as strong at identifying those students with internalizing behaviors. And so when we are looking at more universal approaches across the entire student population, that's an equity practice because we're able to, we're knowing that we're systematically putting supports in place for everyone. And there are a few different models that are out there in terms of what school mental health can look like across the tiers. But generally speaking, that first tier is mental health promotion. Students at tier 2 might be at risk for a mental health condition or concern. And students at tier 3 are those that have those known concerns, perhaps a mental health diagnosis, not necessarily, right? But regardless of the concern, we know we're talking about students whose challenges have a clear impact on daily functioning. And I want to mention that, you do not have to have a formal MTSS structure in place to deliver supports and services in a tiered manner. We know that implementing these frameworks is a systems change process and does take time. And so, it's something just to be aware of and something to work towards. But you can still be viewing the supports and services that you're offering from the standpoint of what all students are going to need versus what some students are going to need versus what a few students might need. So we're going to talk about, before we get really into the tier 1, there are several foundations for school-wide mental health that really support moving into this tiered approach and really are critical to be thinking about, from the get-go in terms of getting started if you are looking to move toward a more systematic way of doing this. So these are some of the indicators of quality for school mental health teams, and feel free to enter into the chat, what teams you have in your school or district or program that are working to address mental health issues among students. And this doesn't have to be their explicit focus or their only focus, but feel free to share what teams you have that might be working on student mental health. You probably have many different teams, whether if some of you are working in AED-wide programs, some of you are in districts where you might have different teams at the building level or the district level. But generally speaking, the goals of a school mental health related team would be to meet regularly, use database decision-making, and action plan to support student mental health. And some of these teams, examples of these teams could be a school climate team. They could be your student assistance program, your SAP team, a crisis team, or there might be other teams. If you are implementing an MTSS structure of some sort, you might have, tier 2 teams or tier 3 teams. I know that the number of teams can get overwhelming. And, now, especially as we've been adjusting with all the changes under COVID, there might be teams that are shifting in terms of their roles, or, certain personnel may not be available to participate on teams. And so you may be at a point in time now where you're really reassessing that. But when it does come to supporting student mental health, one thing that is clear is that decisions really shouldn't be made by one person alone. And a lot of times that's what has happened when it's come to student mental health issues in schools, is that it gets referred solely to a counselor or someone like that who makes a decision, and having a team to kind of follow a process is very important when it comes to making these kinds of decisions, and thinking a little bit outside the box in terms of who might be on these teams. So, for example, there might be other staff within the school or the program that have a certain expertise or have firsthand knowledge or experience that they can use to contribute, like a school nurse, right? And so we don't necessarily always think of our school nurses as being on our teams, but they may have certain established connections with family members when youth have medical conditions, or they're the ones, a lot of students that may be experiencing a mental health condition may have some physical symptoms or psychosomatic complaints, and they visit the nurse's office frequently. So the nurse may have, kind of some of that data or firsthand information that really can contribute to team processes. We also know that youth and families, they are the experts in their own lives, and they bring their firsthand experiences to the table, and that can help highlight for schools some areas of needed change. It's helpful. It can be very helpful, and it's very important to identify how families can directly contribute to shifts in policies or shifts in protocols. There's a few other resources on this slide that can really be used to look at your teams, to look at aligning teams, or to assist with team processes. So I have those here. I won't go into them in detail, but they'll be here for your reference. As another foundational element, needs assessment is used as part of comprehensive school mental health approaches as a foundation to kind of start give a roadmap and start off this process. So what you're doing with a needs assessment is identifying both the needs and strengths within a district or school or program that are related to mental health. And so you'll want to gather data from multiple stakeholders, but you don't necessarily, with a needs assessment, have to survey every individual in the school community. So there's lots of different ways that you can do this. There are different tools out there. I have a sample from Wisconsin. I'm going to talk about another example in a second. But you may, start by pulling a team together that can have, a shared conversation to inform some of the information that goes into the needs assessments. It can be used to look at different components of comprehensive school mental health that you might have in place, and that's what Wisconsin's model does, and that's the link here on the slide. Or you could be looking at patterns of specific need. So you might want to explore how current services and supports are meeting student needs, for example. There's a lot of different ways that you can tailor a needs assessment based on the information that your school may want to gather. And I want to share in a moment the SHAPE system, which is another great resource developed by the National Center for School Mental Health that is free for schools and districts to utilize. But the bottom line is that there are many tools out there, so schools don't have to reinvent the wheel when it comes to looking into this process. So the School Health Assessment and Performance Evaluation System, SHAPE, is free and includes a range of tools that include quality indicators that can actually assess a range of components, including data and the degree to which your school or district or program is utilizing best practice around mental health strategies across the tiers. There are lots of tools within this online platform. At the current moment, I'll just say that they have, every school and every district in Pennsylvania and also nationally, when it comes to programs, they don't necessarily have those preloaded, but you can request to have your program added. They might have to classify it a little bit differently, like as a school, for example, in order for you to, access the system, but they'll work with you if this is something that you want to look into, and I'm happy to answer questions about this at the end. But you can utilize their needs assessment tools. They have a huge resource library, and you can also then get your data back and be able to look at that for action planning purposes. This is just another example. Their mental health quality assessment does look at the 7 indicators. I know it's a little bit blurry that you're looking at on the screen, which include, teaming, needs assessment and resource mapping, screening, and then looking at mental health supports and services across the 3 tiers, as well as things like sustainability efforts and impact. So since I just mentioned resource mapping, I want to move into this because this often goes hand in hand with needs assessments. And a lot of times when schools are trying to move into this process of figuring out what programs they need or what supports they need, it's really helpful as a starting point and as a foundation to map. We call it mapping. It doesn't look like a map, but it's really just organizing and documenting the existing internal and external supports that already are in place. And I've heard a lot of conversation happening around resource mapping, especially with COVID, knowing that the availability of supports and services in the school and in the community are changing. The availability of prior community partners has changed, but what this process does is it gets everyone on the same page, because what happens a lot in schools is that one person knows about this resource in the community, and another person knows about this referral option, and another person knows about this strategy. And it helps to avoid duplication. We don't have, the time or resources to be duplicating our efforts, but we often do. So it helps to avoid that. It helps identify gaps. So for example, if you're mapping all the mental health related supports and strategies that you have across 3 tiers, you might notice that, there's a lot of things that you have at tier 3, there's a lot that you have at tier 1, but there's very little at tier 2. So it helps, draw teams' attention to those areas that may need to be worked on or prioritized. And it really helps ensure that the options that are available within the school and community are accessible to all students, and not just based on the knowledge or connections that one individual staff member has. So again, it's an equity practice. And what you see in this example here are some of the resources that could really be salient to school mental health efforts, especially thinking about building continuity of care for students that are at risk or have known mental health conditions, knowing that a lot of times they have multiple system involvement. And, you know, not all schools or teams might have the capacity to map, you know, multiple resources within the community. So it can be helpful to engage others in this process. So you can rely on your community partners. You may have your SAP liaisons or CASP coordinators or other county level staff, your SCA that can really assist with, you know, mapping outside of the school community if that's what you're looking to do. And the Center for School Mental Health that I've been mentioning also has some helpful guides and templates to assist in this process. But ultimately, I guess the last thing I want to say about it is that when you do needs assessment and you do resource mapping, those two things go hand in hand to help your team select and plan and implement appropriate services and supports. And over time, this ends up being a living document. Over time, you can look at the services and supports that are not having the desired impact and choose to either remove or replace them. So we've been talking about community partnerships. I'm sure that, you know, all of you have many, and that there are diverse, you know, partners that, you know, participate in teams or assist the school in a variety of ways. So feel free, if you'd like, to enter some of your partners or the types of partners that you have into the chat. But, you know, a lot of times we think of community partners as being more essential at the advanced tiers. So like I was saying before, students that are already at risk or have known mental health conditions. But there's really strong reason to incorporate community partners at the universal and primary levels as well. Just kind of thinking about the expanded impact within our ecological model, right, when our systems are working well together. So there's a lot of ways that partners can support universal efforts, whether that's coming in to help with awareness campaigns, whether they're helping to lead universal trainings for staff, or helping with screening efforts. We've seen some examples of that in Pennsylvania. But, you know, when community partners are familiar with and invested in what the school's doing around mental health, that provides a stronger foundation to build upon when it does come to moving into the more targeted or intensive services. These are just some guiding questions for policies and procedures, and I'm not going to spend a ton of time on this, but you know, this is a huge foundation for your efforts, especially the specific protocols that are developed to align with your policies. And so we know that, you know, schools have to have policies and procedures for a range of mental health related topics. And again, some of you now are probably thinking about how those might need to be slightly revised, or, you know, if implementation for current protocols may need to change, for example, with your suicide prevention and intervention response protocols, if you're in a hybrid structure right now. But just to kind of put these out there in terms of how they should be informing kind of moving into the strategies and supports that you'll be implementing. And the last foundational element is really database decision making. So, you know, we know that across all of our initiatives in schools, data is really at the core. But when it comes to school mental health efforts, especially, there's been less success, I would say, in terms of using data to drive decisions. There are many types of data I've tried to list out here, in kind of the range of data sources that can be used to inform school mental health efforts, and they do not all involve directly assessing student mental health. So screening is on here, but screening data is one of the few sources. It is a very helpful source of data, and I'll talk about it more, but it's not the only source. And so it's helpful to think outside the box. As I mentioned earlier, visits to the nurse's office. We often will look at our referral data, like our SAP referral data or our referral data to advanced tiers. But that's often kind of been the limit where schools have stopped in terms of tracking. And so it's important to figure out as well, what services and supports are students actually engaged in? And then are we following up and kind of monitoring? Do students improve in terms of their functioning based on the supports and services they're receiving? And it's easier, I think, it's been easier for schools to do that with other areas that feel a little bit more objective sometimes, like reading levels, or with a specific behavior goal, than it has been around a mental health related outcome. But that's something to think about for teams in terms of how you will be tracking to determine whether students are doing better and making progress when they're getting certain supports. So moving into kind of what those universal strategies are, mental health promotion is really, this is the definition, right? And it's also known as Tier 1 supports and services. And I just really want to underscore that school-wide mental health is not just about bringing therapy into the schools. It's broadly defined, and as I go through, some of the key components of it, you'll see that very many of them are familiar to you in terms of things that you may be doing or know about, but haven't necessarily thought of as your school mental health efforts, and they very much are. So this is just highlighting some of the value of mental health promotion at a Tier 1 level, and think about how you might utilize some of this messaging to advocate for the importance of school-wide mental health within your settings. One of the biggest pieces really being around the stigma. And so what is the messaging that's going to help propel these efforts? Because it's been a long-standing concern that we kind of view mental health as being reserved for just a few. It's those students that are struggling with mental health, when in reality, all of us need to work to maintain our mental health, and none of us are immune to developing a mental health condition. So it does, affect everyone, and we can kind of use some of this to help reinforce the value of this and try to combat some of that stigma. So these are the actual components of what Tier 1 services and supports might look like in a school. And, for time's sake, I really will only be touching on these today. And again, I know a lot of you have a level of familiarity with many of these already or are directly implementing them. So I know there's a lot of expertise here. I'll talk about some of these more than others, but again, just trying to really reinforce that point that these are part of your comprehensive school mental health strategies. And, we just always want to be thinking about best practices whenever we implement any initiative or intervention. So again, just kind of a range of questions to get us thinking about, all of these different pieces in terms of resources and capacity and fidelity and cultural and linguistic competency. So I won't really go over these much more, but these are the components of school climate. So school climate is the first piece. And, these are the components of school climate according to the Safe and Supportive Schools model. And really, in a lot of ways, school climate is an overarching strategy to many of the Tier 1 activities that are part of comprehensive school mental health. We know that if you have positive school climate, you're likely to have fewer discipline problems, less bullying, less aggression toward teachers, higher graduation rates, and there's also impacts from the research for staff as well. So decreasing rates of teacher turnover, improvements in teacher satisfaction, and things like that. And among our students with disabilities, we know that, a poor school climate can be tied to reports of feeling alienated from school or disinterested in school, feeling disrespected or not cared about by school staff. So kind of thinking back to the PACE data earlier, and that the majority of schools don't feel, the majority of students don't feel kind of connected within their school environment. School climate is really a way of getting at that. And there is a big initiative in Pennsylvania around school climate happening through the Office for Safe Schools and connected with the intermediate units. So there are many resources for looking at a strategic approach to school climate. And in fact, looking at some of these best practices, these are all certainly tied into what Pennsylvania is doing, and the assessment of school climate can really be utilized almost like needs assessment data that I was talking about a little bit earlier. So when you're gathering feedback in certain dimensions like student engagement or student staff or staff or student-student relationships or the learning environment, that can be one way to get some data that can be used to drive your school mental health efforts in terms of addressing the environment and the school community. So educator resilience, well-being, and self-care. We know that this area has not previously received the attention that it has deserved. And now more and more, it is getting some attention, just recognizing all that teachers and really all staff, including administrators, are balancing right now. We know that, those in education tend to identify as the helpers. That's a big reason why a lot of us go into education. And especially when we're working with more specialized populations that may have higher rates of trauma or behavioral issues or mental health concerns, it really can take its toll. So this is something that a lot of schools, districts, programs are starting to think about, and supporting staff wellness can really happen at the individual level. So in terms of what we're promoting to our staff with things like self-care and boundary setting, as well as at the organizational level. So at the organizational level, we can be thinking about some of the resources, support strategies that we're putting in place to help our staff feel supported, which in turn can help promote their wellness. So that's just something to think about in terms of those formal and informal activities that are happening within your schools and programs. And, you may think about, here it talks about assessing educator well-being, which is something that there are existing tools for. The professional quality of life scale, for example, which you see here in the Compassion Resilience Toolkit, that has a measure, and certainly when you would assess directly something like teacher well-being, you'll need to think about privacy and anonymity when collecting that information, and really how you want to use it. You don't have to use or do a formal survey, but could do things like focus groups to get feedback from staff on the things that could be done at the organizational level to better support them. Considering things like trainings on self-care, or building this compassion resilience. And I really encourage people to look at this Compassion Resilience Toolkit. There are many resources in there to support educator well-being. I am not going to spend a ton of time on positive behavioral interventions and supports because hopefully most of you know what that is, but I do want to just underscore again how this framework and how your behavior initiatives are also aligned with your school mental health initiatives. And there are many supports in Pennsylvania if you are not implementing PBIS and are looking to move in this direction. I will also highlight the Interconnected Systems framework, which looks at aligning and really creating a single delivery, a single system of service delivery when it comes to school mental health by aligning PBIS and school mental health systems. Again, trying to reduce the duplication, the number of teams that have to meet, and sort of streamline efforts. And there's tons of resources through the Interconnected Systems framework. They just came out with a second volume on how you can work with your PBIS structures and build upon that to do that integration and alignment work. But certainly Patton can direct anyone here to more resources on PBIS. To circle back to relationships and connectedness, I just want to briefly underscore a study here, and I won't go into a lot of detail because I know we're getting close to the end of our time. But Peter Wyman recently did a study looking at mapping, and what you see here is the difference between School D and School E, and this is mapping of relationships among students in a school community, as well as between students and staff members. And what you'll notice here is that School D has many more connections, with staff being in the middle and students being on the external of the circle than School E. And he looked at this in reference to suicide attempts. student suicide attempts within the school community. And the reason that I'm sharing this is because what he found is that the schools in his large randomized control trial that had stronger connections, that were more spread out across the student population and across more staff, had fewer student reported suicide attempts, significantly fewer. That was a significant finding. And so it does reinforce this idea of needing to build these connections and how important that is to our foundation of creating an emotionally and psychologically safe environment for our students. There are a few other resources I want to highlight around building connectedness, and restorative practices is one of those, in terms of really emphasizing the importance of relational needs in the community and fostering student accountability for behavior. And the other resources that are here involve strategies like relationship mapping. What we want to see to promote connectedness in schools is that there's no anonymous student. And so there's some tools out there where you can, really strategically look to see, are all staff, if you listed all students, can you identify at least one staff member that is connected to that student? And how are you identifying the students that don't have those connections, right? So in some ways going back here and kind of looking to see that, there are some students that are not reporting any connections to any adults at school. And so these types of strategies can really be used to monitor that and to build from those areas of need. Social emotional learning, what I will mainly do is refer you to some great resources from CASEL, which is the Collaborative for Academic, Social, and Emotional Learning, just for the sake of time, but they have a fantastic roadmap for school reentry if you have not seen that already. And there will be more resources on that forthcoming, and I have more at the end. Another huge area, and I apologize for going so quickly now, but just for the sake of time, is really building mental health literacy. And this is for all students and staff. And it's different from social emotional learning, which is about building some of those skills, self-awareness, self-management, things like that. And this is more explicit in terms of developing knowledge around mental health and promoting help seeking and teaching the school community how exactly to do that. It's also about normalizing this concept of mental health, as I've been trying to underscore throughout the presentation, as something that we all have to work to maintain. So some of you may have heard of trainings like Youth Mental Health First Aid or Question, Persuade, Refer. And these are really general trainings. When we talk about mental health literacy, we want to think about delivering this kind of content and building this kind of literacy, not just with staff or professional staff, but with all staff, right? As well as with students and also our families and our communities. And so some of what I just said is sort of recapped here, but in addition to training, other ways to build mental health literacy can come through awareness efforts and campaigns, the sharing of mental health and crisis resources. And what you see on the screen here is actually a PSA for the National Suicide Prevention Lifeline that was created by a high school student in Pennsylvania. And we have resources, free images that can be used in email messaging, or I'll make a plug for my virtual background. That's another poster that was created by a student in Pennsylvania. So what are those opportunities to promote awareness, to share resources, to post that information, and to think about even our trainings and education as not just like a once and done, check the box kind of thing, but also when do we need to give refreshers? When do we need to give staff the opportunity to talk through some of our protocols and ask questions about those to make sure they're understanding and things like that. With universal behavioral health screening, what I will mainly say about this is that there is a big national focus now on more proactively identifying students with mental health and behavioral health needs, just knowing that the prevalence is high. And so, there are a lot of resources for mental or behavioral health screening. A lot of schools that are doing PBIS are looking at social emotional screening. A lot of times it's happening more at the elementary level. But I've shared, just an example of an array of screeners for this. The thing to be thinking of, these are some considerations to be aware of if your school is contemplating doing screening. And just know that this is something that is a process. You have to really think carefully about your protocols for how you would want to set this up, whether you'd want to work with your community partners to do something like this, and how you develop decision trees. And I would absolutely emphasize that any school looking to do a universal mental or behavioral health screening should really consider a resource mapping process first, because we know that if you screen, you have to intervene. And so if a school is feeling that they're ill-equipped to respond to some of the needs that can come up through this type of screening, it would not be advisable to move into this practice. But it could be something to work towards. And there are, supports and resources nationally and in Pennsylvania if you are interested in something like this. And I've shared one of those on the screen. So just to kind of finish up, I know I'm really kind of cutting it close with time, and I want to leave at least a couple of minutes, but I've highlighted a bunch of universal approaches and also the foundations that are needed to kind of set the stage for moving forward with those universal approaches at Tier 1. But there is a lot more at the advanced tiers that we could be talking about. And there is the need in a lot of cases for additional training for staff, whether that's around doing things like screenings or risk assessments for suicide or threat assessments, or whether that's around implementing an intervention at the advanced tier like CBITS for trauma, or Coping CAT for depression or anxiety. It's important to be thinking about streamlining referral procedures and looking at your teams and who's doing what, and figuring out where referrals should be going for these kinds of concerns. And the other big thing that I want to talk about here that I haven't touched on as much is at the advanced tiers, we're having to also really think about the role of community partners and how we can identify any gaps to help support students, especially that are coming back from a hospitalization or an RTF or out of school placement that do have mental health needs, and sometimes there's a need to kind of activate a child find process, and other times there are some supports that can be put in place and it doesn't need to automatically go in that direction, and schools should be really thinking about that to support students coming back in, back into district that are struggling and what may be needed there, as well as how to monitor those students in an ongoing way. So again, there's a lot more resources there, but I'm gonna just stop and let you know that there are some Pennsylvania specific resources I've included, as well as national resources here too. And I believe you'll all have access to the slides. And I'm happy to just kind of pause and see if we can at least take a couple of questions.